Hello, Samuel. My name is Dr. Blessing.
Hi, doctor.
Okay, I'm here to carry out some examinations on you, which includes motor examination, sensory examination, and reflexes. And I'm going to be starting with motor examination, and I'll have to observe and inspect your upper limbs. Is that okay by you?
Yes, doctor.
So first of all, I would like to adjust your sleeves. So as carry out your general inspection, focus on body position, check for involuntary movements such as tremor, tics, chorea or fasciculations. Also observe muscle bulk. Inspect the size and contours of the muscles. Do the muscles look flat or concave, suggesting loss of muscle bulk from atrophy or wasting? Okay, so from my inspection, there is no abnormal muscle bulk. There are no involuntary movements like tremor. There is no fasciculation. Everything seems. Checking for the tone of your upper limb. On each side, note muscle tone, the resistance offered to your movements. If you suspect decreased resistance, hold the forearm and shake the hand loosely, back and forth. Normally, the hand moves back and forth freely, but it is not completely floppy. We are going to perform a parental drift test. So can you put your hand like this for me? Then just a little, just pressing. Then can you close your eyes? Okay. Normally, the patient should be able to hold this arm position well for about 20 to 30 seconds. So, in inspecting for the muscle strength, it is graded on a 0 to 5 scale. Grade 5 is active movement against full resistance without evident fatigue. Grade 4 is active movement against gravity and some resistance. Grade 3 is active movement against gravity. Grade 2 is active movement of the body with gravity eliminated. So for grade 1, a barely detectable flicker or trace of contraction is noticed. Then for grade 0, no muscular contraction is detected. Then go ahead to test for flexion and extension at the elbow by having the patient pull and push against your hand. Test extension at the wrist by asking the patient to make a fist and resist you as you press down. Or you can ask the patient to extend the forearms with the fingers straight and palms up. Then press the palms downwards. In testing for finger adduction, position the patient's hands with palm down and fingers spread. Instruct the patient to prevent you from moving any of the fingers as you try to force them together. It's also very important to test opposition of the thumb. Inspect for weak opposition of the thumb in median nerve disorders such as carpal tunnel syndrome. Samuel, we're going to be examining your lower limbs. Can you please lie down comfortably? Assess the tone of the lower limbs by gently rolling the legs back and forth. So, next, lift the patient's leg up slowly from the knee. You start by doing it slowly, then go ahead to do it quickly. This is to check for tone, so feel for rigidity, spasticity, and flaccidity. To elicit clonus, support the patient's leg and briefly dorsiflex the patient's foot. Sustain the dorsiflexion.
To test for adduction at the hips, place your hand firmly on the bed between the patient's knee and ask the patient to bring both legs together.
For abduction of the hips, place your hand firmly outside the patient's knees, ask the patient to spread both legs against your hands. So we're going forward to test for ankle eversion. So ask the patient to evert his leg, then ask the patient to resist you as you try to push the leg inward. So go ahead to also check for ankle inversion. This tries to elicit for problems in the tibialis posterior muscle. We're testing for ankle plantar flexion to elicit for problems in the gastrocnemius muscles. So this is to test for ankle dorsiflexion and to note any abnormalities in the tibialis anterior muscle. We are now moving over to reflex examination. Moving over to plantar reflex. If the patient's reflexes are symmetrically diminished or absent, use reinforcement, a technique involving isometric contraction of other muscles for up to 10 seconds that may increase reflex activity. For bicep reflex, the patient's elbow should be partially flexed and the forearm pronated with palm down. Place your thumb or finger firmly on the bicep tendon. Aim the strike with the reflex hammer directly through your digit towards the bicep tendon. Moving forward, this is the brachioradialis reflex. And for the tricep reflex, while the patient is sitting or supine, flex the patient's arm at the elbow with palm towards the body and pull it slightly across the chest. Strike the tricep tendon with a direct blow directly behind and just above the elbow. To elicit the ankle reflex, strike the Achilles tendon and watch and feel for plantar flexion at the ankle. Also note the speed of relaxation and muscular contraction. For plantar response, closely observe movement of the big toe, normally plantar flexion. And so it's time for the sensory examination. Is this cold?
Yes.
Is this cold?
Yes.
So can you close your eyes? You tell me what you feel, either sharp or dull.
Sharp. Dull. Sharp. Dull.
Can you close your eyes still? Can you feel something?
Yes.
Can you feel it?
Yes.
Can you feel anything?
Yes.
Okay. Please, then I'll place something in your palm. You will help me identify what that is somewhat. Can you get your palm and your eyes closed? So, what is that? Oh, excellent. Open your eyes. So the next one, I'm going to draw something on your palm and identify what letter or number that is. So can you close your eyes? Give me your palm.
3.
Then I'm going to tell you, give me your hand. I will make movement with your hands and you tell me what you feel, whether it's up or down. Can you close your eyes still?
Down. Down. Up. Up.
Well, that is all for now with your motor and sensory and reflex examination. Thank you.
She's the one behind the camera. Yay! I'm a signing out.